Hi, my name is Catherine Schutte, and this week's training will focus on employee wellness programs. Before I get started on the training, I want to take a moment to introduce myself and provide you with some information on my background. I am currently a student at Texas A&M Central Texas. This is my second semester, and I am currently working towards my master's in Human Resources Management with an expected graduation date of December 2015. My educational background includes a bachelor's in justice studies from Pittsburgh State University in Kansas. Additionally, prior to starting this program, I was a student at the University of Southern California. I graduated this past spring with a master's in public administration. Over the years, I have worked and volunteered in a variety of different positions, from my time in the military as an intelligence officer to my ongoing volunteer work serving as a neighborhood team leader for a political campaign. My passion is leading and managing people in the workplace and all the different intricacies that go along with that. Ideally, I would like to work in an HR department for an organization that is actively engaged in social justice issues. Although I have a pretty diverse background, I have limited practical HR experience. While some of the work I've done is transfer to the HR field, in order to gain more experience and to enhance my education, I am currently interning at an HR office, which I will discuss further in the next slide. I am currently interning at Seton Medical Center, Harker Heights. I've been with the hospital since July. The hospital has approximately 200 employees from a wide range of disciplines, including nurses, doctors, technicians, food service associates, administrative personnel to IT. As an intern, I am involved in a variety of projects, but one that has been especially rewarding is being part of the Wellness Committee. For this reason, I was excited and eager to learn more about employee health programs, which I will be going over today. This training is a combination of new information that I have learned and information that I have gathered through experiencing a wellness program firsthand. I hope the information provided in this training will increase your knowledge on employee health programs and assist you in the future development or implementation of such programs. The agenda for this presentation is as follows. Upon completion of this training, you will be able to analyze employee wellness programs and apply best practices in the field by comparing and contrasting the information you learn in this training with real-world wellness programs. In this week's reading, Werner and DeSimone 2012 highlight that although personal problems such as stress, alcohol and drug abuse, obesity, or mental illness are typically seen as something that an individual should deal with outside of the work, the reality is that these problems affect individuals at the workplace. Consequently, these problems can be very costly to employers by contributing to health insurance costs, absenteeism or turnover rates, accidents, and decreases in productivity. According to Werner and DeSimone, one estimate places lost productivity at over $100 billion annually for alcohol and substance abuse, and over $51 billion annually for absenteeism and lost productivity. In addition to productivity issues, personal problems can lead to increased healthcare costs for both employees and employers. According to Abraham et al. 2011, between 1999 and 2009, health insurance premiums doubled. In addition, a study in 2009 found that employers would pay on average more than $28,000 a year per employee on health care by the year 2019. Considering the increasing cost to both the employee and the employer, over the last 3 decades, employers have turned to employee wellness programs to encourage employees to make healthy lifestyle decisions to help alleviate the rising cost in healthcare. So, what exactly is an employee wellness program?
Let me demonstrate. Now, you might want to step back. Okay. Perfect. Yeah? Yeah. All right. No, look further. There you go. All right. Euro, training, Euro, training. That's one.
Although the previous slide is a funny illustration of an exercise workout, exercise is one type of intervention used in a wellness program. An employee wellness program is an employer-sponsored program that provides a coordinated and comprehensive set of strategies aimed to encourage a healthy lifestyle and create a healthier workforce. The following list are some of the most common strategies. Although the programs are generally designed to support behavior conducive to the health of employees, the programs range considerably. Werner and DeSimone, 2012, identified 3 levels of employee wellness programs. Level 1 programs are primarily focused on providing educational activities. These programs are not necessarily focused on changing behavior. Level 2 programs are aimed at bringing direct behavioral change. Level 3 programs are focused on creating an organizational environment that helps employees maintain healthy lifestyles. In addition to the levels, there are several interventions. Highlighted in this slide are some of the most popular interventions, along with some examples of components. Educational services, for example, educating employees on eating healthy through a class or a newsletter. Individual health risk identification, for example, a health risk assessment or a questionnaire. Health risk reduction services, for example, on-site counseling or support groups. Treatment health services, for example, offering clinics for care on-site. Prevention health services, for example, offering immunizations or offering healthy food alternatives. And finally, health-related regulation, for example, a workplace non-smoking policy. Research on employee wellness program highlights that they can lead to change at both the individual and organizational level. Overall, the potential benefits and outcomes of employee wellness programs include lower costs for both the employee and the employer in things such as healthcare costs, higher productivity as a result of less absenteeism and lower turnover rates, and finally, higher morale as a result of better self-image or trust with an organization. Although there is continuous debate about the overall effectiveness of wellness programs and their potential to lead to the outcomes previously mentioned, there is less of a debate on some of the specific interventions of an employee wellness program. 4 of the most popular include smoking cessation programs, exercise and fitness, nutrition and weight control, and control of hypertension. In the last decade, organizations have significantly increased their sponsorship of smoking cessation programs. Smoking cessation programs have the strongest evidence of effectiveness. Measures of success for smoking cessation programs are the quit rate and the percentage of smokers who participate in the program. Overall, these programs have been found to have a positive cost-benefit ratio. Although the evidence for the effectiveness of the physical activity component is mixed, the majority of the evidence indicates positive benefits. Physical activity is linked to decreased absenteeism, turnover rates, and stress levels. In addition, they are linked to increased morale and productivity. Programs also have the potential to decrease medical costs by reducing the risk of obesity, type 2 diabetes, stroke, and osteoporosis, in addition to lowering a person's risk of developing or dying from heart disease. In regards to cost benefits, one study by Abraham et al. Found that each additional active day per week was associated with 4.7% lower healthcare spending over an 18-month period. Considering these benefits, it's easy to see why the physical activity component is so popular among employee wellness programs. The results for programs that include interventions aimed at changing dietary habits is mixed, with long-term effects being the hardest to measure. However, results indicate that weight control programs can lead to short-term weight loss. Nutritional and cholesterol programs can lead to dietary change and attitude change. and longer, more intrusive programs of either or lead to better results. Research on control hypertension interventions highlights the effectiveness it can have on reducing blood pressure and increasing participant knowledge about their health. In addition, the use of biometric data to keep employees informed on their blood pressure has resulted in a success rate of 50 to 75% of employees managing their blood pressure over a period of time. Finally, the cost savings of the program was found to be $1.89 to $2.72 reduced healthcare claims per dollar spent on operating a hypertension program. According to the Centers for Disease Control and Prevention, CDC, the average American working a full-time job spends 1/3 of their day, 5 days per week, at work. With employees spending so much time at work, some obstacles to living a healthier lifestyle, such as finding the time to work out or see a doctor, aren't a problem if the workplace offers certain aspects of the employee wellness program. Several studies have gone as far by saying that the employer is in a better position to eliminate certain barriers to change than the medical community. As Rowan and Harris 2014 mentioned, companies are a microcosm of society and an important and unleveraged setting for health improvement and risk reduction. With such opportunities, employers are increasingly turning to the employee wellness programs. So how exactly does an organization go about creating a wellness program? The CDC has a very informative website dedicated to workplace health promotion. On their site, they provide a variety of tools on employee wellness programs, including general guidelines for starting a program and managing the program. Step 1. Capture management support and conduct a needs assessment. It is recommended that organizations create a wellness committee to oversee the process. The committee should assess the workplace and identify health risks. This information can be used to highlight the opportunities that a wellness program offers the organization. In doing this, the wellness committee can help build management support for the program and ensure that it is relevant to the organization. Step 2. Using the information gathered from the previous step, the wellness committee should create a plan to implement the program. This can include setting goals and objectives for the program, creating a timeline, creating a budget, and determining what type of interventions will be used. For example, will the interventions be level 1, 2, or 3 as previously discussed? The Worksite Health 101 training manual and the CDC both provide an extensive list of interventions that are commonly used to deal with certain health risks. In addition, they provide the associated health impact point values. Finally, during this step, the committee should be implementing marketing strategies, which includes communicating with the employees by getting feedback and providing them with information on the program. Step 3. Once the foundation of the program has been established, the next step is implementation. While there are a number of ways to implement the program, the key is to make sure that the program is comprehensive, including a combination of individual and organizational strategies and interventions. Step 4. The final step is evaluation. This ongoing process defines the value of the program. The evaluation information helps prove that the wellness program and its interventions have been effective and build the business case for continuing them. The CDC also provides extensive information on how to conduct a program evaluation of a wellness program. Some of the primary outcome measures that should be evaluated include worker productivity, healthcare costs, health outcomes, and organizational change. While the previous slide highlighted general steps found in the literature for creating a program, the literature on wellness programs also provides information on best practices for the ongoing management of a program and keys to a successful program. In the next few slides, I will be reviewing the most relevant studies. According to Matkey et al. 2013, there are 5 factors that influence the success of an employee wellness program. Effective communication strategies, an opportunity for all employees to engage in the discussion of the employee wellness program, leadership engagement, the use of existing resources and relationships, and continuous evaluation. In a review of 10 organizations with financially sound wellness programs, Berry et al. Identified 6 pillars to a successful program. Multi-level leadership includes passionate, persistent, and persuasive leadership at all levels. Alignment, making sure the program is a natural extension of the organization's identity. Scope, relevance, and quality, making sure the program is comprehensive, engaging, and worthwhile. Accessibility, making sure the program is accessible to everybody, therefore the goal should be for low-cost or no-cost services. Partnerships, programs should strive for collaboration with internal and external partners. And finally, communications. The program should be seen as more than a mission, it should be seen as a message, and therefore extra care should be taken in how that message is delivered. In addition, Werner and DeSimone 2012 identified several necessary ingredients for an effective employee wellness program. Top management commitment and support, clearly written set of policies and procedures outlining a program's purpose and its function within the organization, cooperation with local unions if they are present in the organization, a range of care, for example, referrals to community services to follow up, clear and well-enforced policies concerning employee confidentiality, a maintenance of records for program evaluation, health insurance benefit coverage for services, and finally, family education. And finally, Henning et al. 2009 and the Workplace Wellness Toolkit identified that a successful employee wellness program captures employee, management, and leadership support, and also uses a participatory approach to employee wellness program, which includes employees and management actively engaged in the decision-making, problem-solving actions, and evaluation of the program. After reviewing the various studies, there are 5 strategic factors necessary for managing a successful employee wellness program. The program should include effective and efficient communication strategies. Leadership engagement and commitment are critical to a program, especially at the beginning. Relationships and partnerships to leverage resources can help create a successful program by making it engaging and worthwhile. Accessible and involved employees increase the sustainability of the program. And finally, the program should be relevant and should strive for continuous improvement. In addition to the 5 strategic factors, the literature highlights the need for a program to be both comprehensive and inclusive. A comprehensive program includes multiple interventions and components. A program using these techniques reaches more people and addresses more health risk, thereby increasing its chances at leading to positive results. Overall, the literature on wellness program highlights that programs can be extremely beneficial to an organization. An employee wellness program is an employer-sponsored program that includes coordinated and comprehensive strategies aimed at creating a healthier workforce. There are 3 levels of programs ranging from 1 to 3, with 1 being the least comprehensive. Within each of these levels, there are a variety of interventions and components. Because wellness programs vary widely, evaluations of programs often cannot isolate the components that are most effective. However, the literature does provide best practices in the field. The keys to a successful program include effective communication strategies, a high level of leadership and management support, leveraging partnerships, engaging employees, and keeping the program relevant by evaluating it on a regular basis. Finally, the program should be broad and inclusive. They should include multiple components in order to meet the various needs within an organization and to increase participation. Programs that follow this guidance are more likely to see positive results and outcomes, including higher productivity, reduced absenteeism, reduced turnover rates, and lower healthcare costs. After this training, please proceed to the discussion and activity to apply the information you learned in this training. Thank you for your time.